Hi class, this is Dr. McGonigal with another lecture for your Introduction to IO Psychology class. Today we're going to talk about research methods in IO Psychology. So why is it necessary to talk about research methods in an IO Psychology course? Well, if you remember from our last lecture, IO Psychology is the application, the study and the application, I should say, of research methods to understand workers and the workplace and to make them both better. So in order to do that, we need to have an understanding of research methods. Research methods is really fundamental to IO psychology. That's why we are taking a whole week to learn about research methods, and you have a whole chapter in your textbook devoted to it. So where is IO psychology research conducted? It's conducted in academic settings like universities. It's also conducted in organizations. So researchers might go into organizations to study the workers. It's also conducted online, and we're going to talk more about the settings of research as we go through this slide deck. Let's talk about theory and the research process. You may have heard about theory before in other classes. A theory is a description of the relationships among variables and how these variables influence each other in order to explain a particular phenomenon. So we're going to talk more about what a variable is later in this slide deck. But for now, you should know that a theory helps us understand why something happens. So a theory is pretty broad, and it provides a starting point for studying something and guidance for how to study it. So a theory is sort of our starting point in a lot of cases for research. Empirical research is research that is based on direct or indirect observations to see if theoretical principles hold when tested. So we do research to test things in organizations and with workers in IO psychology, and we use these findings to help clarify or change the theory in some way and propose directions for future research. So particularly in deductive research, which I'll talk about in just a moment, we start with a theory, we conduct research to test that theory, and we use our findings to refine or to change that theory in some way or to support that theory. So in this way, we can think about theory as informing research, which informs the practice that we do in organizations or with workers. And in turn, the practice influences the theory. So all of these three things, theory, research, and practice, influence each other. So in IO psychology, we have the scientist-practitioner model, which I talked about in our last lecture. That is the mutual influence of science and practice. And what this diagram is showing you on slide 6 is how they influence each other. In terms of the research process, research published in journals typically involves sort of a similar structure, and you may have seen journal articles like this. First, they review past theory and research to say what has been done and what do we know could possibly apply to this situation or to this research question. 2, they describe the study methods and results. And 3, they conclude with implications for practice, theory, and future research. Okay, so I'm pausing here to show you an example of a research article. And this is an article that IO psychology researchers like myself would publish. And this is in the Journal of Applied Psychology, which I mentioned in our last lecture as being one of the best known journals in our field. So in this study, myself and my colleagues examined individual and work factors that relate to something called perceived workability, which is workers' perception of their ability to continue working, and labor force outcomes. So what happens if they perceive low workability, for instance. So in this first part of the article, we give the background. This provides understanding of research that has already been done and the theory that we are using to help support our hypotheses. So after we finish with the introduction, in which we explain again the theory and our hypotheses, we get into our method. And in the method, we explain what we did to actually study this. So who were the participants in this study? What were the measures or the methods that we used? After the method section, we talk about the results. So after we have finished collecting data, we analyze that data and we describe the results here in our results section. And then after the results section, we get to a discussion section where we talk about summarizing sort of the results that we got and what are the implications of those results. So what does this actually mean? How can we take this information and apply it in the workplace? Okay, so now let's talk about deductive research versus inductive research. The article that I just showed you is an example of deductive research. That is when we start with a strong theory and we set out to test hypotheses based on that theory. Most research within IO psychology at this point in time is deductive research. And so in the lecture today, we are going to mostly talk about deductive research. However, inductive research in the green box on the right-hand side is gaining traction in IO psychology. So that means that more and more researchers are doing this. And in inductive research, we start with observing a phenomenon, and then we develop a theory to try to explain it. One very prominent theory in IO psychology is called goal-setting theory. And you may have heard of this theory before. It's fairly simple, and it basically says that setting goals leads to better performance than not setting goals. So if I want to perform better as a worker, I am going to be able to do that better if I set specific goals around it. And goal-setting theory started out just with researchers looking at workers' performance in the workplace and realizing that people who set goals did better than people who didn't set goals. And then the researchers conducted a series of studies over many years to refine it. So they tested different characteristics of goals to see what types of goals were more effective at work performance than other types of goals. So some of the things that they found, for instance, include goals that are more specific help performance more. Goals that are attainable help performance more. Goals that are relevant help performance more. And so all of these things came together in an inductive manner to create goal-setting theory. So the researchers in that case didn't start with a theory, they started with their observations and the data, and they ended up with a theory. So that's the difference between a deductive approach and an inductive approach. So let's talk about the research process. We have 6 steps here that we're going to go through in detail, and so I'll explain them first, an overview of them here. Number 1, we state the problem or question. Number 2, we develop hypotheses, and again, what we're going through here is based on deductive research. Number 3, we choose the best possible research design for our question. Number 4, we collect our data. Number 5, we analyze data. Number 6, we interpret the results and state the implications. Step 1, we state the problem or the question. So in this step, you develop your overall research question. So think about, what do you want to understand? And in doing so, as IO psychologists, we think about the importance of the question. So why does this need to be known? For example, in the article that I showed you earlier with workability, the reason my colleagues and I felt that this needed to be known is that we are currently experiencing an aging workforce. So what does that mean? It means that in general, the workforce in the United States and actually around the world is getting older. So there are fewer younger people that are coming into the workforce than there are people who are aging in the workforce currently. So given that the workforce in general are getting older, I should say, it becomes important to understand factors that affect people's ability to continue working. Because in some cases, in some industries like healthcare, for instance, we will experience labor shortages as people end up leaving the workforce because they feel that they can no longer continue working. So we felt it was important to understand factors that affect workability in order for us to be able to make recommendations to organizations as to how they can help promote workability. So for instance, one thing that we found is that good supervisor support and good job control, levels of control that people have over their work, were factors that led to better workability. So to the extent that companies can allow these things to happen for their workers, provide really good supervisor support, provide better job control, that is going to lead their workers to feel like they are better able to continue working. Okay. So, for example, I want to understand why workers are getting injured on the job. And a reason why this is important is because injuries are harmful to workers and cost organizations money. So this is another example and one that we will follow through the next several slides. Step 2, we want to state our hypotheses. Again, this is relevant to deductive research. So for inductive research, typically you would not have hypotheses ahead of time. You would take a look at the data and see what the data is telling you and generate conclusions from that. But in deductive research, we start with our theory and our background, and we come up with educated guesses or hypotheses, and then we test those hypotheses. Okay, so like I was just saying, hypotheses are these predictions or educated guesses about certain variables and how they operate. In terms of coming up with hypotheses, we consider theory. We also consider prior research findings, so we conduct a literature review. Using the example that we just talked about on the last slide, say that I conduct a literature review and I find that something called safety climate is important for promoting a safe working environment. So safety climate is the degree to which individuals within an organization feel that safety, physical safety, is valued, and that their physical safety is of importance to their managers and to their coworkers and to the organization overall. So theory, for example, social exchange theory, supports this as well as prior research studies. For example, this one that I have here by a researcher named Zohar in 1999. So I have taken both theory on social exchange and prior studies that have found the importance of safety climate, and I use those to come up with my hypothesis that poor safety climate will positively relate to worker injuries on the job. So in other words, if safety climate is low, if people feel that it's not valued, their safety is not valued, then there will be more injuries for workers on the job. In step 3, we want to choose our research design. So in this step, we are deciding how we are going to test the hypothesis that we've come up with. So the first bullet here is asking, will we use primary or secondary methods? Primary methods are when you use new data from actual people or organizations, and secondary methods are those when you use existing data from prior studies. So an example of a secondary method is called meta-analysis. Meta-analysis is when you take a bunch of studies that have already been conducted. So, for example, if my co-authors and I realized that there were already a whole bunch of studies done on workability, maybe we wouldn't conduct a primary study like we did. Maybe we would conduct instead a secondary study, and we would just take the findings from all of those different studies and summarize them and create a study that summarizes those results. So we're going to focus mainly on primary methods in this module. So that's focusing again on collecting new data from actual people who are working or organizations. What type of method will you use? That's another question that you have to answer when you're choosing the design that you use for your research. Experimental methods are one type of major category of method that we'll talk about. And non-experimental is the other type of major category that we're going to talk about. So within experimental and non-experimental, you need to think about what type of experimental and what type of non-experimental method will you use. Also, what is your research setting? Will you conduct your study in the field? So what do we mean by the field? Basically what we mean by that is you're conducting your study in an actual organization or wherever people are working. So if you're studying restaurant servers, for example, you could conduct a study in an actual restaurant. You can conduct studies online also, or in a laboratory. So in terms of picking your research setting, you have to consider your research question, the study goals, and any limitations. All right, so we are going to get more into talking about different methods, but before we do, I want to go over two types of validity that are really important to keep in mind. So you need the background on these types of validity in order to understand sort of the pros and the cons of different types of experimental and non-experimental methods. In terms of internal validity, this tells us whether we can attribute the study outcomes to our study variables. So, for example, if we consider a drug trial, we would ask the question, did the participants, so in this case the patients, recover or fail to recover from an illness as a result of getting an experimental drug or not getting the drug? So in this case, we want to know, did the drug actually work? Did it actually work in terms of having the patient recover from the illness? And we want to know that, the bolding of as a result is really important here. So we want to know that the recovery is due to getting the experimental drug and not due to other things. So, for example, is the patient also getting other types of drugs at the same time that could possibly confound those results? That would be something that we would want to control for in that case. Okay, so anyway, internal validity is how confident we are that the outcome, in this case recovery from the illness, was due to the drug being administered. That would be our variable and not other things. Okay, this confidence that we have about that is the degree of internal validity in our study. So in any kind of study, you can assess the degree of internal validity and talk about any limitations to internal validity by thinking about the result. So what is the outcome that you're looking for? In this case, it's the recovery from the illness, and thinking about whether or not how confident you are that is due to the variable that's being manipulated or studied. Okay, so that's internal validity. External validity is referring to whether or not our results can generalize to other people or contexts. So in this case, for external validity, we're thinking about the sample that we're using to study something. For example, I conduct a study to test the effectiveness of supervisor support on workers' intentions to leave a job, and I have college students complete a survey. So college students tell me about their levels of supervisor support at work, and they tell me about how much they want to leave their job. And the question here would be, how confident are we that our results would generalize or spread from our sample of college students to the working population in general? So we would want to think about, are there things that make our sample maybe systematically different from the working population overall? So you could think about college students and the types of jobs they have and the number of hours they work per week and the other things that they have going on in their lives and their education levels and things like that. So thinking about how college student sample could be different from the general worker population and how that could affect your confidence that the results would apply to other people. Okay, so let's talk about choosing research designs. In experimental designs, a researcher manipulates a variable, for instance, a training, a condition, which would be called an independent variable, and observes the effects on another variable, which is called a dependent or an outcome variable. Okay, so the key word in experimental design is manipulate. So that's why I have it bolded and underlined. Every time you have an experiment, a researcher is manipulating something. So for instance, they are giving participants a drug or not. Maybe the drug group gets the drug, the control group doesn't get the drug. That would be a manipulation. A training. So some workers get a training, some workers don't get a training. That's a manipulation. So that word manipulation is what you want to think about when you're thinking about experimental designs. A true experiment is an experiment where there is a high level of control. So a true experiment, for instance, is something that you would want to do when you have a drug trial, because you want to know, is the results that you're getting from the drug trial in terms of recovery from an illness or maybe failure to get a type of virus if you're testing a vaccine. You want to know that it's a result of the actual drug and not something else. So in that case, you would want to use a true experiment that has a high degree of control. The hallmark of a true experiment is random assignment. So if you are wondering, you're looking at a study and you're wondering, is this a true experiment? Look to see whether there's random assignment in addition to that high degree of control. Random assignment means that workers are randomly assigned to different conditions. So it's not one group of people get something, another group of people get something else. It's that participants are randomly placed into groups. Now, why is random assignment important? Well, it's important because, again, we want to be sure that the results of our study are due to the manipulation. We want that high level of internal validity. And if we have, for instance, some systematic differences between the groups based on, like, for instance, how they want to be added to the trial. So say everyone who wanted to get the experimental drug gets the experimental drug and people who didn't care got the control drug. Well, that's a big difference between the groups. Maybe the people who really wanted to get the experimental drug are also just generally better at taking care of their health and more proactive. That would be a systematic difference between the groups that could affect the result that you're getting in terms of the recovery from the illness. Okay, so that's a true experiment. A quasi-experiment has less control and may not have random assignment. So a quasi-experiment still has a manipulation. So you're still giving some people a training or a condition or something and others you aren't, for instance. So you're still manipulating something, but you may not have random assignment. Now, quasi-experiments are pretty common in IO psychology because it's really hard to do a true experiment in an organization for reasons that vary from the organization just won't allow you to randomly put workers into training conditions. So if you approach an organization, you say, hey, I have this wonderful training that's going to help your workers perform better. They may not want you to just give it to some workers and not other workers. So you may have more of a quasi-experiment. They might say, well, we have this one group that really needs the training, so you're going to give it to them. Or we have one group in one location and one group in another location, and you can test it on this one group and not test it on this other group, but then later on you give the training to the other group as well. So anyway, for a quasi-experiment, you might have already existing groups, so you're not giving random assignment and you have less control, but you're still manipulating something. There are also types of non-experimental studies, and these are when researchers study existing phenomena, but they do not manipulate a variable to observe an effect. So let me give you an example before I talk through each of the types of non-experimental designs. If I want to study the influence or the relationship between personality, so someone's personality and how they perform at work, their job performance, I can't manipulate their personality, right? It's part of who they are. So I'm not going to manipulate it and conduct an experiment, but I am going to study it. I might ask them to report on their levels of different types of personality dimensions. So I'm not manipulating it, but I am studying it and I am observing effects of it, right? Okay, so a correlational study is one type of non-experimental design. And the most typical way of doing a correlational study is by using survey data. You could also use other forms of data. So you could use things like student grades, so getting grades from a college registrar or something like that. Sales dollars, so you could get that information from organizations. So in the example that I just gave you about personality, I could have people respond to a survey about their personality, and then I could get the number of sales dollars or the number of sales that that person made in a year from their organization. And I could do this for like hundreds of people. And then I have a lot of data and I can correlate their personality with their sales dollars earned and see what that relationship is and test my hypothesis that way. The second type is qualitative, and this is, for instance, using interview data and open-ended survey responses. Qualitative studies tend to be inductive as opposed to deductive. These are when you're getting very detailed responses from individuals about their experiences. And it's much richer data than survey data because you're getting more information and understanding. But like I said, it is more of an inductive approach. Qualitative research is less common in IO psychology, but it does happen. So you do see some qualitative studies in IO psychology. A case study is when you have a single person or organization that you are studying. Case studies are more common in areas like clinical psychology or counseling psychology, when you perhaps have an individual with a type of mental health problem and you can talk in detail about that mental health problem and what the treatment is and what the outcome was for that one person. In IO psychology, it's pretty rare to see a case study, but you sometimes see them about organizations. So a person might explain a detail about a problem that an organization is facing and what that organization is doing or has done to deal with that problem and what the outcome was for that organization. Observational studies are when the researcher goes in and observes or perceives something directly. So an example of an observational study would be if a researcher goes into a factory and watches workers working in that factory, and maybe they want to understand the safety climate of the factory. So rather than asking them questions about the safety climate like you would in a correlational study using survey data, you could actually just observe what they're doing in the organization. Are they working safely? Are they wearing hard hats? Are they wearing other PPE? Are the managers coming around to observe whether or not they are following safety guidelines? Things like that. Okay, so let's talk about some features of a true experiment. And I know that I already talked about these a little bit in the previous slide, but we'll go over them again. So first, they use an experimental group that receives a manipulation. Second, they use a control group that does not receive the manipulation and is used for comparison. So the control group could get nothing, or it could get what we call an active control, which is a different type of manipulation. It involves random assignment of participants to experimental and control groups to ensure equivalence between groups and to avoid confounding variables. So I talked about this in a little bit more detail a few slides ago. It can be done in online settings, so using like online survey type tools to conduct the experiment where participants, once they click on the experiment, are randomized into different conditions. Or it could be conducted in a laboratory setting or in a field setting. True experiments conducted in a laboratory setting typically involve college students. So for IO psychology, you might have a study, for instance, where you're bringing in college students and you're conducting some sort of manipulation. So You're having them do something, you have a control group, and you're observing the results. So these types of studies that are conducted in lab settings can be very cost effective. So usually college students will get course credit for participating in these. Sometimes they might get a small amount of pay. But think about what you think about the levels of internal validity and external validity in that case. So remember, internal validity is the confidence you have in the outcome, and external validity is the degree to which it's generalizable. So in terms of internal validity, we might think that there could be a high level of internal validity because it's in a laboratory setting, so it's pretty well controlled. We have random assignment, so internal validity seems fairly good. But what about external validity? Do we think that having college students do something in a lab is really going to reflect the real world in an organization with people actually working? So I think there are a couple issues there. The first is that maybe college students might be a little bit different from the general working population in some ways. And the second is that just the setup of it, being in a lab and doing something, that's a lot different than actually being in a work organization and having your job depend on it. True experiments conducted online typically involve paid participants. One example is called MTurk. There are other ones too. Lots of different online platforms that we call crowdsourcing. And essentially researchers can post studies and they pay participants to participate in those studies. Because you can get a lot of participants very quickly, these are time effective, so they're quick. But what do we think about levels of internal validity and external validity? Kind of similar to what we talked about earlier, in terms of internal validity, you do have a fairly high degree of control, but we might have concerns about how people online may not be paying attention, right? So what if they're just clicking through things online and they're not really doing the manipulation, or they're not really answering the questions appropriately? Well, that would affect the levels of internal validity in this case. In terms of external validity, you would need to take a look at your sample. Is it demographically representative of the population in general? Are these people who are actually working? Who are these participants? And that would affect your levels of external validity. And you also want to think about the online setting. How would that affect your levels of external validity? Would it be truly reflective of the workplace? Well, maybe if the person works primarily online, but maybe not if they're working face-to-face with people. True experiments conducted in actual organizational settings are called field experiments. So I mentioned the word field earlier. These are considered the gold standard for evaluating the effects of a workplace policy or intervention. So that means that's what we strive for. They have high levels of both internal and external validity because they are true experiments and because they are done in these actual settings where people actually are working. So they have sort of high levels of internal validity because they have that control, and they also have good levels of external validity because they're in the actual setting where the work happens. However, that all seems great, right? But they are relatively uncommon because they're difficult to carry out in organizations. They require that a company is willing and able to assign workers to different conditions and use random assignment. And certain manipulations might be unethical in organizational contexts, like I mentioned before. So you have to kind of think through these different things, and these are reasons why they're fairly uncommon. Let's talk next about another experimental design type, which is a quasi-experiment. A quasi-experiment means an almost experiment design. Almost a true experiment, I should say. It approximates a true experiment, but it's missing at least one aspect of a true experiment, such as random assignment to conditions. It can be very practical in a field setting. For example, you could provide a diversity training to employees in one organization, but not another organization. So that other organization serves as a control, and then you compare the rates of minority hiring in each. All right, so how would this work in terms of levels of internal validity and external validity? So could you think of any other things that may affect the rates of minority hiring beyond the fact that people are provided a diversity training? That would, if you can think of some of the things that may affect minority hiring beyond diversity training, in this case, that would affect the levels of internal validity. So because we don't have random assignment and we don't have as high a degree of control, the levels of internal validity are slightly lower. They're still better than they would be if we conducted, say, a correlational study using surveys or something like that, because we're still manipulating something. So we have that going for us, but we have a lower level of internal validity than we would with a true experiment. In terms of external validity, we have, I think, a very high level of external validity because we have an actual field setting. We have an actual organization that we're doing this in. So it's reflective of what happens in the real world. All right, so let's talk about non-experimental types now, the first being correlational studies. These focus on relationships among variables, and they lack the variable manipulation and experimental control that you have in a true experiment. So again, in correlational studies, you are not manipulating anything in observing results. You're just studying things that actually exist. For example, does the level of teamwork within teams in an organization relate to worker productivity? You could survey workers on their levels of teamwork and then correlate what they say with their performance ratings that you get from their manager, for instance, in order to test that question. Some advantages of correlational studies are that they can be done in organizations using samples of actual working people fairly easily, so more so than an experiment. They also typically involve practical and inexpensive forms of data collection, such as surveys. But what do you think about levels of internal validity? So let's think about it. We're not manipulating anything, right? We're just asking people about their level of teamwork, and we're asking them about their productivity, or we're asking their managers about their productivity. So are there other things that could be affecting their productivity besides their levels of teamwork? You know, we don't have a lot of control in this study. We're not isolating the effects of teamwork. We're not manipulating the levels of teamwork. So our internal validity is relatively low compared to what it would be if we had an experimental design. In terms of external validity, you would ask yourself, are the workers that you're assessing, are they representative of who you want to generalize to? So are they representative of all workers within that organization, for instance? You have generally a higher level of external validity with these types of correlational studies than you would with an experimental study, depending on the type of experimental study. Some limitations of correlational studies. First, it can be difficult to determine causality, the direction of relationships between variables, or whether one causes another. You can maybe study one thing before the other thing. So say that you survey them on teamwork before you ask their managers about their performance. That's one step toward helping to understand the direction of that relationship, but it's not sufficient. So in general, when you have correlational studies, you really can't determine causality. Inflated relationships can also happen due to the common method that is used for all variables or a common source. So for instance, the same participant is rating the survey items. So we have an example of people rating their personality and then telling us about their own productivity at work. Well, because you have the same participant providing their answers to both in the same format, like a survey, you could possibly have inflation of those. So say I'm in a really good mood when I'm filling out the survey. I'm going to say, yeah, my personality is this. I also have really good work productivity. The relationship between those two things could be inflated based on my good mood that day. So let's get back to our example. Hypothesis 1 is that poor safety climate will positively relate to worker injuries on the job. And you may pause the video if you want, but you can think about one type of research design that you could use to test this hypothesis. Would you use an experimental design? Would you use a non-experimental design? If you chose an experimental design, really think it through. So do you think you could possibly manipulate safety climate? I would say it's possible, but it's unlikely, especially in an organizational setting. So the safety climate generally is what it is. It's generated between the workers socially within the organization and by the managers and leaders in the organization in terms of their value of safety. So I would say that a non-experimental design is a better option for testing this particular hypothesis. What type of non-experimental design could you use? So the best type that I would recommend for this particular question would be a correlational design. So I would survey workers on their perceptions of the safety climate within their organization, and I would also look at organizational records of worker injuries on the job, and I could correlate those two. So what are some pros and cons to using this design? We could go back a few slides and look at those pros and cons, but some off the top of my head are that we have fairly quickly, we could conduct this study because we could survey people, a lot of different people fairly quickly on their levels of safety climate, their perceptions of safety climate. We could get that information on injuries as well fairly quickly. A con might be that we have maybe lower internal validity than we would if it was possible to use an experimental design. All right, so as we wrap up this video, we're going to check your knowledge. And to check your knowledge, I'm giving you two different scenarios and asking you about the research design that is in the scenario. So take a moment to read this scenario here and pause the video if you need to. So what is the research design that is used in this case? Well, we can see that it is a true experiment, right? Because the researcher has randomly assigned people to either go through the coaching program or to serve as controls that do not receive coaching. Okay, so there is a manipulation in terms of people getting the coaching program or not getting the coaching program, and there is random assignment, so we can say that it is a true experiment. Okay, so now take a moment to read this scenario and pause the video if you need to, and I will tell you the answer. Okay, so what is the research design used in this case? Well, in this case, it is a non-experimental design, right? And it is an observational study. How do we know that it is an observational study? Because the researcher is sitting there and observing things like the interaction between the customer and the server, and the time that is spent, and the smiling behaviors.